Good day with everybody. Um, Once again, I'm gonna present you my third presentation. It's related to one free topic. In this case, I choose coronavirus or COVID-19 disease. Well, um, as everybody knows nowadays, is one of the um, most infectious and contagious disease that is surrounding on the air in every part of the world. Um, some of you have you ever heard something about the way that it can be spread, contaminate everybody else, any other person that is next to you. Um, More than that, this is one of the viruses, one of the new viruses that have been discovered on the beginning of this new 2020 year. Um, has become and it has become one of a global pandemic and the first cause of death on these days, on these following months of this year. Well, I gotta focus in three different areas. First, how to get infected with this virus. A healthy person can be infected. The second point would be the symptoms that would be appear. At the end, method to prevent these infections to be contaminated with this virus. First, how the healthy person can be contaminated. Well, as this is a virus, the primary source of contamination would be um, the drops of saliva when you sneeze or when you cough. Um, that small that those small particulars uh, that goes around the air or only stays in one surface can be a focus of contamination, a place of contamination. Another way to get infected is to get in contact with, as I mentioned before, a surface or an object that being in contact with one infected person. Well, immediately the virus transferred to you directly just for simple contact. Other people say that it also can be grab this virus by the air, but it's not 100% um, sure. Then, as a second point, I would say the symptoms of a person that being infected by this virus. One of them it would be for a healthy guy that doesn't have uh, pre-existence viruses or or any special condition would be um, regular symptoms as a flu, a cut, or also fever. It depends also on your organism. Then the other set point on this would be on elder people due to the elderly and the or the high age that they have. They makes more they makes more um they give you at the end more problems. Some of them that may have respiratory problems, cardiovascular problems, cancer, are more likely to get zero symptoms for this disease. And at the end, would be get them directly to the ER, urgent care. Then, as a third point, I would say how to prevent. to get infected. I know that everybody uh, might be pay a lot of attention on this, might pay a lot of attention on this part. Well, first, one of the advice that I would give you is to protect yourself. Wash your hands constantly. Keep using if you have alcohol products, alcohol in jail, hand sanitizer, rubbing your hands, and avoid the contact with um, with your face. Another method would be to avoid crowded places. Please don't go out, especially nowadays that the virus is practically around the area in every places. Basically, right here in Florida, we are uh, one of the states that have a higher amount of contaminated persons, infected person with this virus. So stay at home, stay safe. The use to well, make sure to use also mouth covers. That's necessary. Those mouse that's that mouth that mouth mask, they're essential nowadays to avoid to be contaminated. At the end, covers your mouth with with something, with a towel, with a paper, well, whatever that can covers you. The to covers you from the environmental. Then to conclude, um, at this moment there are not vaccinated. There are not vaccine or any special treatment to face this virus. The thing is prevention measures. So please stay home. Don't auto-medicate yourself. Try to uh, keep informed with all the details that they are giving on television. Try to avoid those fake news. Um, Stay home, stay safe, and strictly follow all the authorities' instructions. At the end, we know that we're gonna face up of the we're gonna pass this pandemia, and then well get back to the regular days as soon as possible. Well, thank you so much. Bye bye.